Nursing Assistant Exam Questions 2024. Let's get started. What is the first thing a nurse aide should do when finding a client who is unresponsive? Is it A, start compressions? Or B, call for help? Could it be C, close the door? Or lastly D, call family? The correct answer is B. Here is why. Activating the emergency response system summons advanced help immediately. Option A, start compressions, is done after calling for help if the client is pulseless and not breathing. Option C, close door, is not a priority in a life-threatening situation. Option D, call family, is inappropriate until the emergency is managed and information is available. Next question. When operating a manual bed, the nurse aide should remember to: is it A, elevate the client's head at all times? Or B, lock the wheels when the cranks are folded? Could it be C, fold cranks under bed? Or lastly D, keep the bed in the neutral position? The correct answer is C. Here is why. Locking wheels prevents the bed from moving when folded cranks, a tripping hazard, are underneath. Option A, head elevated, is incorrect. Head position is adjusted per client need, not constant. Option C, fold under, is incorrect. Cranks should be folded up and out of the way, not under the bed where they protrude. Option D, neutral, is not a standard term. The bed is put in low position when care is complete. Next question. The nurse aide is preparing to provide oral care for a client who is unconscious. The nurse aide should place the client in which of the following positions? Is it A, supine? Or B, lateral? Could it be C, prone? Or lastly D, Sims? The correct answer is B. Here is why. The lateral, side-lying, position allows fluids to drain from the mouth, preventing aspiration. Option A, supine, is incorrect. It would cause fluids to pool in the throat and be aspirated. Option C, prone, is impractical and may compromise breathing. Option D, Sims, is a side-lying variation, but lateral is the standard specified position for this procedure. Next question. The nurse aide should place the soiled linen. Is it A, on the floor? Or B, on the chair? Could it be C, in the dirty linen container? Or lastly D, on the overbed table? The correct answer is C. Here is why. Placing soiled linen directly into a designated hamper contains contamination and follows infection control principles. Option A, on floor, contaminates the floor and spreads microorganisms. Option B, on chair, contaminates furniture. Option D, on overbed table, is incorrect. The overbed table is for clean items and food only. Next question. The nurse aide is caring for a client with diabetes. Which of the following would be best for the nurse aide to use when shaving the client? Is it A, a safety razor? Or B, an electric razor? Could it be C, a disposable razor? Or lastly D, a straight edge razor? The correct answer is B. Here is why. An electric razor minimizes cuts and nicks, reducing infection risk for a client with diabetes who may have poor wound healing. Options A, C, and D, safety, disposable, straight edge, are all incorrect because they use blades that break the skin, posing a greater risk of infection. Next question. The nurse aide is caring for a client who only speaks and understands a foreign language. Which of the following actions should the nurse aide take? Is it A, use gestures? Or B, speak slower? Could it be C, listen and say nothing? Or lastly D, use an interpretation guide? The correct answer is D. Here is why. An interpretation guide or professional interpreter ensures accurate communication about care needs. Option A, gestures, is error-prone for important information. Option B, speak slower, is ineffective if the client doesn't understand the language. Option C, listen and say nothing, does not facilitate necessary two-way communication. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.